Hello everybody, good morning, good afternoon, good evening, depending the time you're coming across this video. You're welcome to my YouTube channel. So on today's topic, we are going to be speaking on a topic, we are going to be talking about urinary tract infection, its treatment and prevention, including the symptoms, the causes, and then effective strategies to prevent reoccurrence. Please, if today is the first time you're coming across this channel, please do well to like, comment, share, and subscribe to my channel for more of these wonderful health talks. So, meaning of UTI, urinary tract infection. Urinary tract infection is an infection in any parts of the urinary system. These include the kidney, the bladder, the ureter, and the urethra. And so most UTIs involve the lower urinary tract, which is the bladder and the urethra. So having talked about what UTI is, I would like to talk about the common symptoms of UTI infection, which number one is burning sensation during urination. Number two is a frequent urge to urinate, even when the bladder is empty. You have this frequent urge to urinate. Number three is cloudy or bloody urine. Once you notice that your urine color is cloudy and is bloody, just know that there is danger on the way. And another thing is strong smelling urine. Urine. And the next one is pelvic pain. The next symptom is pelvic pain, especially in women. You notice that you're having pain in your pelvic. Another one is lower abdominal discomfort. You're having pain on your lower abdominals. And then the next is fever or chills. These are signs. These fever and chills are mostly signs of kidney infection. Yeah, so those are the symptoms. Those are the symptoms of UTIs. Now we'll talk about the risk factors and then the causes of urinary tract infections. So most UTIs are mostly caused by bacterials, primarily the Escherichia coli, which is popularly known as the E. coli, from the bowel. So other causes include sexual activities, poor hygiene, holding urine for a very long period, menopause. By menopause, when I talk about menopause, some people tend to ask, how can menopause be a cause of a cause or risk factor? Yes, menopause is actually a cause or a risk factor because during menopause there is a decrease in estrogen production. You understand? So that is why menopause is one of the risk factors of UTIs. The use of certain contraceptives too is also one of the risk factors of UTIs. And then catheter use. Catheter use is one of them. We have diabetes or weak immune system. This too is also one of the risk factors in UTIs. One of the risk factors of UTIs. Then we have another one. So the next one is kidney stone or urinary obstruction. So these are the risk factors or the causes of UTIs. Now, having talked about the risk factors and the causes of UTIs, we'd like to talk about the treatments of UTIs. So the first line treatment of bacterial UTIs are antibiotics, oral antibiotics. Yeah, and the number two treatments is pain relief. Pain relief actually helps in soothing the burning sensation. It helps to relieve pain, discomfort. But pain relief, note, pain relief is not the treatment of UTI. It's just to help relieve pains. It helps to relieve pains, pains caused because of UTIs. So pain relief is actually part of the treatments you should take. Not that they are the cure to it, but it's just there to help soothe pain and relieve pains. Another thing is the number three treatment is hydration and rest. Yes. So when you drink plenty water, when you drink enough water, it helps to flush out the bacteria. Then avoid alcohol and caffeine. Avoid alcohol and caffeine during treatment of UTI, and then rest regularly. Yeah, so try to rest until the symptoms of until the symptoms improve. Yes, try to rest until the symptoms improve. So these are so that is that for the treatment of UTIs. Now we'll talk about treatment for some specific groups. Yeah, number one on that specific group are the pregnant women. So pregnant women are they require prompt and safe antibiotics treatment due to the risks of the baby. To the risks to the baby. Yes. So the number two group are men. Yes, men actually they require a further evaluations, as UTIs are less common and may indicate an underlying issues. Yes, and another number three people there are children. So children must be treated promptly to avoid kidney damages. So whenever you notice any kind of UTI in children, please endeavor to do what? To take that child to a to a hospital for proper evaluations. Same thing is applicable to men. Whenever you notice any sign of UTIs on your body, please endeavor to go to the hospital to do what? For proper evaluations. Same is applicable to pregnant women. So that is that for treatment for specific groups. Now we'll talk about preventions of UTIs. What you can do to prevent UTIs. So number one there is what? Hydration. A lot of people neglect the fact that they neglect the importance of water in our health, forgetting that water has so many health benefits. So for you to, number one thing you should do to prevent UTI is to do what? To drink at least 2 to 3 liters of water daily. Yes. So this will do what? It will help to dilute urine and then flush out bacteria. It helps to do what? To dilute urine and then flush out bacteria. Number two, prevention of UTI is proper bathroom habits. So try not to hold urine whenever you have the urge, whenever you feel the urge to urinate. Please do. And while doing that, always do what? Empty your bladder. Empty your bladder regularly whenever you have that urge to urinate. Always empty your bladder. Another thing is when wiping, always wipe from front to back. That is after using the toilet. If you want to wipe, if you want to clean yourself, clean from front to back. Then another thing you should do to prevent another thing is urinate shortly after sexual intercourse. Whenever you meet with your partner, always try to, even if you're not feeling pressed, force yourself and try to urinate is one of the ways you can prevent UTIs. So number three things to do after number three things to prevent UTI is good hygiene. Yes, good and proper hygiene. So avoid using harsh soap or all this feminine spray in your genital areas. Avoid it. It's very, very risky. And another thing, try to keep the genital areas dry. Yes, wear cotton underwears and then always try to wear loose fitting clothes. So this can help to keep that place dry and then well ventilated. Allow air to enter that place. Don't always cover. So you talk about recurrent and then what to do. Yes. Number one thing you should do is to get your urine tested and then confirm the infection and then choose the right antibiotics to do what? To treat it. Another thing you should do is to consider low dose antibiotics under doctor's guidance. That has to be under doctor's guidance. Another thing is in postmenopausal women, vaginal estrogen cream may help. Yes, it may help. And another thing is consider further tests like the ultrasound test and then cystoscopy, yeah, to do what? To rule out anatomical issues. Yes, so in that case you can consider going for that further test. So that is that if you are experiencing recurrence. So when to see a doctor. 1. Symptom lasting more than 2 days. All the symptoms that I mentioned, when you notice those symptoms lasting for more than 2 days, my brother, my sister, go and see a doctor. Don't wait. Rush and see a doctor. Another thing is when you're experiencing fever, you're having back pain, or you're feeling nausea, these are signs of kidney infection. So rush and do what? And see a doctor. Once you notice bloody or cloudy urine, please go and see a doctor. Don't wait. Then you notice that you're having recurring UTIs for more than three times in a year. Please see a doctor for further testing and further treatment. And if you're having UTI during pregnancy, please go and see a doctor. If you are a man and you're having UTI, you're seeing the signs, please see a doctor. And if your child is having UTI, if your child is having the symptoms of UTI, please take that child to a doctor. Do not indulge in any kind of self-medication. The purpose of this health talk, the purpose of this health talk now is what? Is to open our eyes to what? To things we need to know about our body, to the signs and to the symptoms of UTI, so that once you start experiencing something like this, what you should do is to do what? Is to see a doctor for proper treatment. And another thing is for you to know how to do what? To prevent those things from happening. Because there are some things you can do as in your own self. There are things you can do you can do to prevent them from happening in the first place. But peradventure, if it happens, if you experience something like this, please do not indulge in any kind of self-medication. Do not take or treat yourself without doctor's approval, without seeing a doctor to even know the kind of infection, to even know the kind of the infection you're treating. Because some you might be taking, for example, you might be taking a certain antibiotics whereby what is actually wrong with you requires a higher or lower antibiotics. So in that kind of situation now, you are actually killing yourself, because that might actually cause antibiotic resistance, as I said in my previous teaching. So the purpose of this is just for you to know the signs, for you to know the ways you can prevent them, and for you to even know what they are, so that once you start experiencing this kind of a thing, you do what? You go you see a doctor or see a health professionals to do what? To help you out. So with that being said, we've come to the end of today's so with all this being said, we've come to the end of today's class, or today's health talk. Please, if you have any kind of question or any kind of confusion or any kind of contribution that you want to put in, please do well to drop it on the comment section. I promise to answer all your questions regardless. So thank you guys for watching through till this moment. I appreciate all of you, and see you guys in my next video.